And now, contraceptive video number 3. These are the best ones on the market right now. That's why they're in blue. Blue means best. So here we go. The first one is the vaginal ring. It is actually just a flexible ring like you can see. It makes you think you're pregnant because there's a hormone inside of it. You leave it in for 3 weeks, so a woman actually puts it up, you can see it here, and it actually kind of locks into your pelvic area, kind of where the diaphragm would lock in. And then you leave it in there 3 weeks, and then it tells your body you're pregnant for 3 weeks. Then you take it out, and then you have your period on week 4. You do get it from a doctor, 91%. If you're over 200 pounds, there's not enough hormones, so they won't give it to you if you're over 200 pounds. So here's what it looks like. Just like it showed on there, and there's hormone inside of there. The good thing about the ring is there's less bad effects, because remember the pill you have to swallow and it tells your whole body I'm pregnant, I'm pregnant. Lots of bad effects because there's just so much hormone. This one is really small. When it goes into your uterus area here, it just has to tell your organs, hey, I'm already pregnant. That way you don't ovulate. If you don't ovulate, then you can't have kids. Again, the doctor would probably give you more if you want to just keep putting them in every 3 weeks so that you don't have a period except for 4 times a year, just like those other ones. Also, they say you could take it out if your husband doesn't like it, like, oh, I can feel it with my end of my penis. You can take it out for up to 2 hours only, and then you can put it back in and it still works. So you'd ask your doctor more, but this is the vaginal ring. Next is the birth control shot. Most of them are called Depo-Provera. There are a few other types. Again, it makes you think that you're pregnant because it's a hormone. You only need the shot once every 3 months. 94 to 98, you get it from a doctor. Most girls actually stop bleeding altogether. You don't have a period anymore. It's usually after your second shot, then you just kind of stop having periods. You do spotting a little bit where you bleed just a little bit, but after that, 70-75% of girls just stop having their period. So that's kind of an added bonus. But there's something bad, of course. Of all the hormonal contraceptives, this one actually does make you gain the most weight. So you're gonna have to fight with your weight and make sure that you know that going into it. So it's super effective, and yeah, you don't have your period, but there is some weight gain. So here it is, just the shot, very effective. Next, this is called Nexplanon, super, super effective. Look at 99.9, you can leave it in 4 years. What is it? It's just one little tube that they put in your arm. How do they get it into your arm? They take this little thing, they slide it under your skin and fire it in there, and it lives in there for 4 years and tells you that you're pregnant. You can kind of see it right here, through there, but they're not super visible. These are super popular right now. There's one before called Implanon, but it got pulled off the market. I can't remember what was doing bad to people, but it was on there. So again, it makes you think you're pregnant. With this one, 1 out of 3 girls stop having their period, which is a wonderful effect, but others have spotting, which is just you bleed whenever, or they have lighter periods, which is also, it's better than having full periods. Now, before Nexplanon came out, there was something in the very late 90s that came out called Norplant. Norplant, there's actually 6 tubes, 1, 2, 3, yep, 6 tubes, and they implanted them into your arm, and they lasted for 5 years. So here's what they look like. This didn't come out as good, but you can actually see them in your arm. And I have these here. That's how the old ones used to look, and somehow they've concentrated and put all that hormone into just one stick. All right, next. The IUD, intrauterine device. Now this is the only one that actually lives in the uterus. Look over here, start. You can actually see it in the uterus. Remember how we got the vagina, the cervix here, and the doctor has to put it up with this handy dandy little gun, and they fire it up and it lives in your uterus. And it can live there, it says 3 to 6 years to prevent a pregnancy. One of the most effective thing, 99.2%. Really, really good. It looks like this little T-like thing. The only bad thing about it, now the makers of the IUD say that it keeps the sperm from actually getting past this little T thing. But we know the sperm are really small, 500 in an inch, and we found out the sperm do get past it. But then when the egg comes down, this thing's rocking around in here like a Pac-Man, and the new embryo can't implant on the wall. So it prevents implantation. Kind of like abortion if it doesn't let the new life attach. It was pulled off the market. Remember, the sponge was pulled off the market because it actually went wild. It punctured the uterus and the fallopian tubes. It got loose and started flying around and puncturing, making women sterile. That's why there's this string, because once a month you would feel up there and say, yep, the string's still there, everything's good. But if it's gone, it might mean this thing has gone wild. But they have assured us it is back on the market. You cramp for 3 to 6 months after insertion is one of the things that they say is bad, because you have something in there and your body's kind of cramping. So let's take a look at this. Here's what it looks like when it's inserted. Notice the string is hanging out there. And here's one in real life. Woo! This one has copper on it. Now, I can't remember. There's all sorts of progesterone ones, there's copper ones, but they do emit something that makes the uterine wall slippery. So if the kid does come down and try to implant, this thing either rocks around like a little Pac-Man or the uterine wall's too slippery. So IUD, and here's another way that it looks. And these are very common now. They're back on the market and they're super, super effective. Sterilization. Okay, this is permanent. This is what old people do when they say, I don't ever want kids anymore. I don't want to use the pill, the patch, the sponge, nothing. I want to be done. So it is surgery. They tie your tubes. What tubes am I talking about? The fallopian tubes, of course. This is permanent. You don't say, well, I'll get sterilized and I'll go back in a couple years and fix it. No, it's permanent. 99.5. Why is it not 100? Because when you cut something, it wants to grow back together. So here you can see different ways that they can actually sterilize a woman. They do it more often laparoscopically. Instead of full surgery where they open you up, they just make little pinholes and they jam these little tools in and they can cut you that way, so it's less invasive, laparoscopic surgery. For the man, it's even easier to be sterilized. Make your husbands do this, girls, because it's permanent again, 99.5, but it's just an office procedure. You go in on Friday and you're back at work on Monday. Just a 2 to 3 day recovery, and they tie your tubes. What tubes are we talking about? The vas deferens. Remember, that's where the sperms travel. So they just go in, they numb your scrotum a little bit, and they feel your vas deferens, or yeah, they can feel it in back, and they pull it out, and then they cut it, tie it, and put it back in place. No big deal, you're numb, you can't feel a thing. And lastly, abstinence. This is the only true thing that's going to be 100% effective, no STDs, no pregnancy. And I encourage you to use that as long as you can to keep yourself safe. Okay, but it's up to yourself, your parents, to make decisions on when the right time is for you. And also, by the time you need any of these 16 different contraceptives, things will probably change and you're going to want to reconsider all the benefits again, either with your doctor or your parents, and try to figure that out. All right, last thing, I have something for you because you need to know about it. It's called the morning after pill. It's called emergency contraception. So your method fails. After sex, you go back and go, oh my gosh, I have 2 pills here still I forgot to take. Or the condom breaks. Or you just have sex and didn't even realize that you didn't have anything with you. So if that happens, you take this pill. It's just a 1 pill. You purchase it at a drugstore. You take it as soon as you can after sex, called Plan B. 95% effective if you take it within 24 hours. 85% within 72 hours. Can be used up to 5 days after, and it still could work. How does it work? It's because it prevents ovulation. That's how it works. It's not like an abortion. It just keeps the egg from coming out, because if there's no egg, you can't get pregnant. Women do complain nausea, vomiting, lower belly pain, headaches after you take it. And it is quite expensive, like $40. So this is not contraception. This is if you forget and it's only an emergency. You don't just buy these and have them in and pop them in after sex. That's not what they're for. They're emergency only. And here it is. Well, this is actually an old one because this is an old kit. Look at the little sparkly pill. Okay, that's Plan B. And last thing, you might want to see this little speculum. Remember, we have to see the woman's cervix to see if she has cervical cancer. We talked about this before. And you can't see the cervix because the vagina is all compressed. So the doctor would put in the speculum and then open it up, and then you could see the girl's cervix. So you'll see this at the doctor office. Girls, you need to see a gynecologist as soon as you're sexually active to make sure things are okay. By age 21, they'll want to see you for sure, and that's when they do the internal exam. But before that, they won't touch you internally, but if you're sexually active, you need to go talk to a gynecologist to be sure that you're safe. That's all I have for now. I hope you learned something.